Welcome to my page. My name is Maxilo. Please don't forget to give me a follow. I came across a video somebody posted concerning this lady, so I dropped a comment. So people were asking me too many questions, and the question was so much, so I needed to clear the air. That's why I'm doing this video. Now, this thing you are seeing this lady is holding her hand is known as a denture. A denture is a prosthesis replacing one or more tooth. That means if you lost one or more tooth, they can give you something like this to replace it. And this thing this lady is holding her hand can be a removable or it could be fixed. Meaning, if it is fixed, this lady cannot remove it. But the one this lady is holding in her hand is a removable denture. That means this patient can remove it and insert it back. Now listen, there's so many things that might have caused this lady to have lost her teeth, which include dental caries. Maybe she had an accident, which is a trauma, or she has a ricket disease, or she had leukemia, or it could be a congenital disease, or it could be a metabolic disease, such as diabetes. What is the function of this denture? This thing this lady is holding. One is to restore her speech, that is her phonetics. Two, for restoration of an aesthetic, that means to restore the facial contour and vertical dimension. Three, for restoration of mastication, so that this lady can actually chew, because if she loses all her teeth, she cannot chew, so she needed something to aid her chewing mechanism and to maintain a space. You understand? To maintain a space and for psychological effect, because many people may not be comfortable showing their open teeth, so they want something to fill it up, and this is why this is very important.